What is angioimmunoblastic T-cell lymphoma, AITL? Imagine a rare but serious condition that affects the immune system and causes your lymph nodes to swell without pain. That's what happens with angioimmunoblastic T-cell lymphoma, or AITL. It is a type of non-Hodgkin lymphoma, which means it starts in the lymphatic system but involves a specific kind of immune cell called T cells. AITL is considered a rare and aggressive form, making up about 20 to 30% of peripheral T-cell lymphomas. It mostly affects older adults, with the average age around 65, but younger people can also develop it. This disease begins when T cells, which are normally part of your immune defense, grow abnormally and multiply out of control. This disrupts normal immune functions and leads to widespread symptoms. The disease often progresses quickly and involves lymph nodes, which are small glands that help filter harmful substances. These lymph nodes usually swell but do so without pain. Besides lymph nodes, AITL can also involve other organs like the skin, liver, spleen, lungs, and even the bone marrow. People with AITL often experience a combination of symptoms. Swollen lymph nodes are common, especially in the neck, armpits, or groin. Many also have systemic symptoms known as B symptoms, which include unexplained fever, night sweats that soak through clothing, and significant weight loss that can be more than 10% of body weight. Fatigue, loss of appetite, and feeling generally unwell are also typical. Some individuals develop skin rashes or itchy skin, which can be quite bothersome. Another important aspect of AITL is its tendency to cause autoimmune phenomena. This means the immune system may mistakenly attack the body's own tissues, leading to conditions like autoimmune hemolytic anemia, where red blood cells are destroyed, or immune thrombocytopenia, which involves the destruction of platelets. Depending on how the disease affects different organs, symptoms such as shortness of breath, abdominal swelling, joint pain, or fluid buildup around the lungs or abdomen can occur. Diagnosing AITL involves a biopsy of an affected lymph node or tissue. Under the microscope, doctors look for abnormal T cells that have specific markers. Additional tests like blood work, imaging scans such as CORT or PET scans, and bone marrow biopsies help determine how far the disease has spread. The exact cause of AITL remains largely unknown, but it is not contagious. It results from genetic and molecular changes in T cells that lead to uncontrolled growth and immune system problems. In summary, AITL is a complex, fast-growing lymphoma that affects the immune system, causing swollen lymph nodes, systemic symptoms, and sometimes autoimmune issues. Because of its complexity, diagnosis and treatment should always be managed by specialists in blood disorders and cancer. If you or someone you know experiences symptoms like unexplained lymph node swelling, fever, or weight loss, it is important to consult a healthcare professional for proper evaluation and care.